I'm going to introduce the Community Health and Social Service Network for those of you less familiar. We've been running since the 2000s, and 2000, I should say, and we work with community partners. You'll see them at the table today. In fact, if you put yourself in a gallery view, and if any of our networks want to put their cameras on, you'll get a sense of how widespread we are. We also work with Quebec's health and social service system to build equitable access to health and social services in English. We're a provincial organization, so that gives us an interesting perspective on the work that I'm hearing today. We bring together a network of over 70 members, and again, we represent the health and social service needs and priorities of English speakers. We collaborate with government, service providers, and community organizations to develop these innovative and sustainable solutions to this equitable healthcare issues that we have. We also act as an important fiduciary for these organizations in our network, up to 200 funded projects currently. And I apologize if I'm speaking quickly, everyone. Tell me to slow down, just wave. I will follow, I will slow. My apologies to the interpreters. I'm just so excited and I have so much to get through. So we have about 83 mental health projects represented out of those 200 funded, to give you an idea of our scope in mental health. We have our core organizations of our network that you see distributed across this map. I won't go into great detail about them, but please feel free to visit our website and have a look. You can tell that we have the organizations here at the table today too who can speak to their work, but I will try to do so as well. Mental health became a core proportion of our activities thanks to that distribution of interest in the last few years for mental health prior to and during the pandemic. Okay, and we also have information that's been shared by the Canadian Mental Health Association Quebec Division, who did a little roundup of information that we were able to offer them on the research in linguistic minority communities' experiences in mental health. And they titled it A Concerning State of Mental Health for English Speakers. So just to run you through a few of these important points that we should all know a little bit about is research that was done in early stages of the pandemic by Dr. Melissa Genereux, the Faculty of Medicine and Mental Health Services at the University of Sherbrooke. She was at the time advisor to Quebec's Directorate of Mental Health Services, and her study revealed that 37% of adults in Quebec, aged 18 to 24, reported symptoms of anxiety and depression in the 2 weeks previous that, and were twice as likely as French speakers to have these symptoms. So that was concerning. Not only that, but she had actually narrowed down by language that Anglophones were of 3 of the top most affected by the pandemic, as was, and young adults as well. So that concords back to the information that we heard from Dr. Fleury and Dr. Groux. The psychological distress we've looked at in the way of fathers and parenthood. We found that English-speaking fathers have reported higher levels of psychological distress in accessing services and in trying to get towards services and in how they're coping. And then we did our own community-based research, actually, on the right-hand side, speaking to English-speaking youth directly and getting their feedback about how they were experiencing access during the pandemic, so access to mental health services during the pandemic. This was run from December of 2021, 2021, and on to March of 2022. So there were still restrictions, but we weren't in the thick of the early stages of the pandemic. And yet 90% of youth reported feeling mentally unwell within the previous 2 weeks, over half of which felt this way all the time or most of the time. Very concerning data. I'd be remiss if we didn't add that our seniors, English-speaking seniors facing these language barriers that many of us do, have a higher proportion of social isolation, which affects their mental well-being. So we have a large portion of programming also that addresses that. And we know most recently published information on early childhood that 30% of English-speaking single parents of children under 5 are living below the Likert scale, so low-income cutoff level, compared to their French-speaking counterparts at 23%. So there is a financial component to the psychological need as well that weighs on parents and single family parents more in our English-speaking communities. I'm going to delve a bit more into the youth component because this was under my mandate. Just a few stats to roll us in was that much like Dr. Fleury noted, the importance of youth in the age bracket of those that will access services is something of note for those with mental health disorders, first-time consultation needs, et cetera, and how this is also the age that is hospitalized as a number one entry point into the health system most often. So to be remembered that those two stats were brought up by our wonderful presenters earlier. So our research-based data confirms that there is a high need from youth, and youth themselves say that there's a dramatic lack of adequate mental health services and supports in English in their regions. This they felt was made worse by the pandemic. And as you can see from Jan's data, of course, there was a huge rise in needs. So naturally, not only was our health system unable to respond at that time, but the English resources available were even lower than usual. So among that little 90% data you saw there, let me just hop over to the 40% of respondents on average declared that they did not have access to a family doctor. I thought this was interesting because Dr. Fleury mentioned that 40% weren't followed by a family doctor in her stats data, non-language specific. And here we have that 60% were not, 40% did not have access to a family doctor. Interesting. Also, that 40% of all the respondents to our survey did not know where they could access health services. So there's a major disconnect in awareness of the service offer. And lastly, of course, most importantly, that language of access will comfort, 46% of respondents said they were not very comfortable or not comfortable at all speaking French and feeling understood when talking about their mental health. I don't think anyone here is terribly surprised by that percentage. But of course, we all agree here that language concordant care is the way to go when we can. But this points out that language remains a quite high barrier, even for our 15 to 29-year-olds. Yeah, so none of this is terribly surprising of a difference from research prior to the pandemic. We do know that young English speakers before were already less likely to describe their mental health as excellent compared to their French-speaking counterparts. They were less likely to state that they had good self-esteem or to report that they had someone to count on. That was research done by Joanne Pocock in 2018. So we do continue to see the trend of low access to information about health services continuing, and that the infrastructure of mental health services for our demographic here contains numerous gaps, which are really important. So all of this seems consistent with our ongoing research. Right, another sliver of data from that, although it's had a very rich crop of data, and do feel free to visit the actual full report, please. I'm just going to highlight a few of the things. Was this little component about financial stress and wellness. So again, one of our speakers was talking about the private practices being at capacity and our move in our sector, in the whole sector of psychologists and those resources moving into private services. Well, English-speaking youth felt there was a high correlation between financial stress and their health struggles, naturally. But this stress is exacerbated by the lack of mental health support available in English in the public sector, combined with the high cost of mental health in the private sector. So this combination of factors means that English speakers without the financial means to pay for private therapy are excluded from access to health services in high numbers. It is really important to note in this case too, that 3 subgroups within our respondents were especially highly represented, and those that said that their mental health was affected by those financial struggles. Financial struggles disproportionately affected the mental health of Black respondents, those issued from the sexually diverse community, non-binary, transgender, two-spirit, or other, and respondents who have aged out of foster care, up to a total of 90%. So of those foster care alumni, 90% felt strongly that this was of high concern to them. So the vulnerability of our groups in mental health are quite high with the reality of the health system as it stands right now. Another tidbit from our crop survey, which is about to be published publicly in October, along with a full explanation date. So if you're interested in that, stay tuned in CHSSN. This crop survey has been conducted in multiple slivers, 2005, 2010, 2015, 2019, and now in 2023. And this little snippet talks about the importance of mental health services being provided in English. So we asked the general public. You can see that the data here veers towards, obviously, very important. The English speakers, whether they asked to be serviced in English or French, all felt, 72% felt that it was very important to be serviced in the language of English. So that's just a teaser. There will be so much more about that coming from the public sector as well, like what health professionals feel about it and the perceptions as well. So stay tuned for that information. Now, with my limited time, I'm still going to talk about CHSSN's mandates in mental health. To begin you off, we have the starting point, the Youth Mental Health Initiative, for which I'm managing, has been running since 2021 and will finish off next year. And the Youth Mental Health Initiative is supported by the Secrétariat à la Jeunesse, as well as the Fondation Lucie André Chagnon, looking to increase access to mental health services and resources for young English speakers, English-speaking Quebecers. So that age range that we were talking about in the previous data. We also have the COVID Mental Health Initiative that ran for 2 years consecutive on 2 different mandates. And the purpose there, I'm sorry, that was supported by the Secrétariat Relations de Québécoises d'Expression Anglaise. And the purpose there was to support a variety of community-based service providers to extend the reach of their services. As we saw the increased needs in clientele, so did we see service providers that could respond in English completely overwhelmed. So the purpose there was to amplify their ability to open up positions and make sure that they could respond to this cry out of need from the community. And one of them was Jean en Tête. Dr. Fleury or Dr. Gros mentioned Jean en Tête. Well, we had all of their things translated. All of those resources were translated by us through this program. Just an example. Lastly, but not least, we have the Supporting and Promoting Mental Health, SPMH. This has been running since 2022 and takes an end in 2024 next year as well, where this is mental health promotion chiefly. We're supporting and promoting mental health of those affected by the COVID-19 pandemic, with a special angle on vulnerable communities of the official language minority. This is also supported by the funder, the Public Health Agency of Canada, as a one-time fund. So we have 27 groups under youth mental health. We have 11 under COVID mental health, and we have 47 under supporting and promoting mental health. And of course, there is some overlap in these groups as depending on their service provision and what they do. Our great outcomes, again, are quite clear. We have a youth mental health initiative that has increased the number of youth informed of pathways to mental health care. Also, we've worked endlessly to empower them to seek it out with mental health literacy activities. And we also advocate on another spectrum with mental health providers and partners so that they're better equipped to respond to the specific needs of our English-speaking youth. The COVID mental health, we increased the reach of service, amplified it, as I mentioned, through program coordination, animation, or intervention capacities going up. And in our supporting and promoting mental health, we will have by the end of 2024, well, the end of the funding year in March, we will have 100 adapted resources, tools, and information campaigns that will have reached 15,000 or more vulnerable official language minority populations. There will also be a production of a provincial promising practices toolkit for mental health that has come from the community sector that I highly recommend you keep an eye out for, because this is going to increase our discussions about facilitators in the community sphere towards mental health. If I still have some time, Andrew, please let me know. I'll go quickly over this part as well. The Youth Mental Health Initiative had a first-year evaluation where we brought together more of the gaps and barriers that communicated directly from youth, communicated from the project leads of the community, from other important sources, from focus groups. All of those came together under the report. So there's a 2-pager that details some incredible information, a depth, a real wealth of information, I should say, about what kind of barriers to access these youth were feeling. Basically, to summarize, few felt that there were clear pathways to care available to them, which is amplified when we consider the obstacles like our language barriers, the awareness of resources open to them, and the capacity of the resources to respond to their needs, naturally. So the gaps become exponentially felt. And there are so many more. Like we could talk about cultural and familial stigma surrounding mental health issues in our communities. We can talk about the large physical distance between youth and existing services for remote communities. We can talk about lack of cultural awareness and needs and realities of English-speaking youth as understood by French-speaking service providers. And then lack of funds to the community sector to make sure that we can continue to bridge the service gap. So basically, where services exist, there's low visibility, it seems, towards this clientele, which is stopping them from using the services or being in the way of using the services. There's also low confidence in their ability to access adequate and timely services, which is no surprise given what we learned earlier about the wait times being quite incredibly long. I forget exactly who said that, but there's also a high demand for psychotherapy. I'm sure Dr. Agro would be happy to hear, coming straight from youth themselves. So I fully agree with her recommendations that she put on earlier. And I invite you to read more in the documents that we have. But to give you hope now, not only do we capture all of these barriers and gaps, but we also are making important changes in the sector. And I say we as a very large we, I'm talking about the community organizations at the table today. So, and not at the table today, but that are working hard to increase a lot of the capacity at this community-based level to inform youth. So they're identifying gaps, they're engaging youth in program design and the community in program design. They're doing partnerships with local schools, public health services, community organizations or specialized organizations. They're adapting, translating, and producing resources, offering activities and programmings by youth or by the community members to make sure that it's responding to their needs. A few good examples are wife P10, I'm just going to throw them out there, who did this wonderful youth transitioning care panel to discuss exactly what difficulties come at an intersection of important identities. So being of the LGBTQIA2 Spirit Plus community and being a youth having transitioned out of care, they had very specific blocks to access to mental health care that were talked about. Super interesting. We've also had organizations run full advocacy programs to better inform people on neurodiversity and on the needs of handicapped youth too, neurodiverse and handicapped youth, such as the Center for Hopes and Dreams that you see there. A lot of our organizations produced huge directories towards resources. So Y4Y Quebec created a provincial level one, that is their mandate, that regrouped by subject, by location, the free resources that youth could access. We also have our local organizations, such as Jan mentioned. So the one in Quebec City also launched a wonderful platform on their site detailing the help resources available in a really intuitive and smart way to better inform their community members. ARC is also one of them they're over in Montérégie. I won't go into all of them, but there are so many in each region pretty much on that map. They've all created something of the sort. And even in Montreal, there are multiple sources. They've also done activities and events just to show you what that looks like. They've gone so far as to reach out online, knowing that that's where some of this component of youth will be. And that's where they're seeking and finding information for health too. So we really need to amp up credible sources of mental health literacy in these spaces that youth are at. Which is a focus that we have as well.
You have about 1 minute.
Thanks.
Wrap up, yeah.
I'll keep going. So this is just going to show you things, but please feel free to look at those slides another time. The mental health literacy component is just important, I'll say that. And lastly, I want to end on another facilitator that was really important. CHSSN held an event in March 2023 to advance collaborative practices in mental health and wellness in the community setting. So we had about 100 participants engaged in these rich discussions that showcase lived experience and research, et cetera, et cetera. If we do another one, you'll be surely invited. We were really attempting to bring together community and service provider programming in mental health that responds to English speakers' needs. So the big outcropping is this. they felt that the need for English-speaking organizations to network and have spaces for intersectoral partnerships was really important, an exchange of expertise, because they've noticed that vulnerable communities like our own are highly fragile and require more collaborative, flexible support and services. I don't think that's a surprise to anyone, but at least you know that the community out there is mobilizing in these areas. So if you'd like to read more about it, we have a report on it that I won't have time to explain, but you're more than welcome to. And from that, we also have a mapping project specific to Montreal, not terribly unlike Jan's, but more related to CLSC type services and how they perceive whether they offer English speaking services and are aware of other services in mental health around them. So this is, I could talk a lot about this, but in the interest of time, just so if you're interested to learn more about the mapping project specific right now to Montreal, please contact Jay Cook at chssn.org. Her email is right there on the slide, and she'll be able to answer your interest. It's really about creating an answer to the need about more awareness between local providers and communities, community services that can respond in English, and how we can do more collaboration together to fill the gaps that we're noticing. It also combines census data. So we do know like literally how many English speakers are pocketed here, and are they using services there? Or are they going all the way across town because they've only heard of this one English service over here? You know, just an example, but it's an interactive map that's come of it. And if you're interested in being part of it as a stakeholder, you'd have to represent an organization and fill in 2 surveys so that we continue to populate the data that's in there. And that's what we've been up to. Can't believe I got through that. If you have any questions whatsoever and you'd like to learn more about it, please feel free to contact me, or in the case of the mapping project, my colleague Jen Cook.